Hi, I'm Dr. Walt Medlin, and welcome to my website. This is BonusLife.com. It's an extension of my blog, and it's my personal website. I am a surgeon at Bariatric Medicine Institute in Salt Lake City, Utah. I have two great partners, Dr. Daniel Cottom and Christina Richards, and you can go to our Bariatric Medicine Institute website for all the information about surgery specifically in terms of our practice. This is more my personal website for education and is an outreach of myself being a sleeve gastrectomy patient now 10 years out, but even more importantly being someone who has struggled with the disease of obesity almost my entire life since kindergarten, and someone who takes care of patients on a daily basis, mostly surgical patients that I see in my practice, but who with the Obesity Action Coalition and in my practice also see many people who have struggled with obesity or have questions about obesity and overweight condition in general. Also, I'm a citizen and I am involved, follow how public policy goes, and I know that there's not many discussions these days in terms of any sort of government or how to build cities or how to fund healthcare without obesity and weight issues being very key to that. So as an introduction to this website, I want to just go through a few of my areas of focus. Then I'm going to be putting more videos so that you can select through and you don't have to watch any long videos from start to finish, and you can go through things as you like if you have something that interests you in particular. I'd like to add more videos as we go along, and maybe some more written articles too, and certainly links to a lot of good things. I want to be a resource where people can come and also find other good perspectives and other good sources of information. So in terms of why am I recording a video and putting it online and going through this stuff that it takes to get this done, I really think that there are a lot of people who are looking for help and looking for reliable sources of information, or at least more reliable sources of information that aren't strictly looking to exploit them or cause them to have more fear or more be scared of solutions or of the problem. So I want to generally give some of that perspective as well, both like I said, as a patient as much as a surgeon. We're going to have videos for sure on diabetes. We're going to have separate video on movement and keeping your body strong as possible, and then cancer risk, and then pre-op surgical and post-op surgical things as well. So look down below. I'm not going to go through all that on here. But again, the main reason I chose the term for myself, it's a little of interest to me, of bonus life, is that's the way I really felt when I had my surgery, is that it really gave me a second shot at life. I really felt like I had, life had almost passed me by in my 40s, and I wasn't able to go and do the things I wanted to do. And now, with surgery assisted weight loss and ongoing fitness and taking general good, reasonable self-care, I wouldn't hold myself out as a perfect example. And I think that's part of another thing I wanted to say, is that I really think that there's a lot of information out there that says you've just got to live perfectly and then everything will be fine. And I think most of us have to be more realistic than that. We have to have a balance. So when I talk about what my real goal is for patients, and I really think that most of us want to live a reasonably long life. We don't want to die young, so we hope to get to at least to 80, and I know there's a lot of people out there more than that, but at least to 80 seems like a good mark to aim for. And then when you envision being 80 years old, it's not just being 80 and alive. You want to be able to live life. So I talk a lot about being a butt-kicking 80-year-old, and that may be different things for different people. Certainly we're all going to have limitations as we age. I have limitations now in my 50s. So it's not unlimited bonus life, but it's definitely a chance to go out and grab a hold of things that I couldn't do before. So I want to talk briefly in the introduction here about weight and our perspective medically in 2019 about hunger being more important than really even talking about weight in terms of changing the dynamic of how your body stores energy, and knowing that there are a lot of things that contribute to your weight over time and to your hunger that drives your weight. So there's a lot of components or parts of hunger that really are related to what we're born with, our genes, not just the genes sort of, if you think of the library, not just all the books that are in the library, but the actual books that are open in the reading room, if you will, and that the body is operating from, and that's called the epigenetics. That's not just the genes you're carrying around, but the genes that are turned on in your body for various reasons, and some of that happens even before we're born, and certainly can be changed as we grow based on the world we live in, or as we call the environment. And the environment can be chemical, it can be traumatic events, it certainly can be illness related, and can be related to medications that we're taking, can be related to sleep deprivation or night shift work or pregnancies. So there's a lot of things that can change, not the genes that are in our library, but the genes that are being used. So that's it's more than just you're born that way. There's also, but a lot of us are born to be very famine resistant. A lot of us put on weight easier than other people, and sometimes our skinny friends have difficulty understanding how that can be. And those genes generally are activated in the body through chemical signals and nerve signals, and we use the term hormones for circulating signals, for chemicals that circulate through our body and give us hunger. So our gut is a very active participant in keeping us alive, keeping us with enough energy to stay alive, and so it sends a lot of signals to tell us when we're hungry and how the digestive process is unfolding. If we're absorbing a lot of sugar, it will send signals. Insulin is a signal that has a lot of different downstream buttons that it pushes, one of which is blood sugar related, but there's others in terms of growth, in terms of muscle work, in terms of the way our body stores fat. And so these signals often have multiple effects. I already mentioned stress and sleep a little bit as being something that can impact. Medications definitely can have an impact. Sleep apnea is one that really doesn't get thought of as disturbing sleep, but then having an impact on hunger very strongly for a lot of people. So treating sleep apnea is not just a matter of changing your sleep quality. The timing of meals, the timing of feeding, I certainly don't want to make anybody think that there's a magic combination where you'll change everything, but I do think we're learning more about the way our body responds to when we feed or when certain nutrients are absorbed. All right, so we'll go on a little more in future about how weight changes in not necessarily a completely regular way, up or down. Life is not fair. It doesn't often seem like weight follows a rational a response, and that can be very frustrating for people and very confusing. And then we're going to talk a little bit about metabolism and being young, having muscle, what your protein intake is, and that there's a lot to be said these days. I think this is a particularly important thing that we're going to talk about long term, is that inactivity is probably as dangerous as almost anything except smoking in terms of our overall health and again our overall wellness. I hate to use the word wellness, but it's still a good word. It's overused a bit. There is some luck, and I want to say that is some to genes, but there's a lot of stuff we don't have a complete understanding of. Just because we don't have a total understanding of this doesn't mean that we can't have a good impact with our medications and surgery. And then carbohydrates, another topic that we'll touch on more in the future. Well, that's my intro at least. Welcome to BonusLife.com.